The thyroid gland is a small, butterfly-shaped organ located at the front of the neck, just below the larynx. Despite its modest size, the thyroid plays an incredibly important role in human health. It produces two key hormones, T3, triiodothyronine, and T4, thyroxine, that are essential for regulating metabolism. These hormones influence heart rate, body temperature, energy levels, the nervous system, menstrual cycles, and the function of major organs such as the liver, kidneys, heart, and brain. When the thyroid functions normally, the body operates smoothly. However, even a slight imbalance in its activity can significantly impact overall health. The most common thyroid disorders include hypothyroidism, hyperthyroidism, goiter, thyroiditis, thyroid nodules, and thyroid cancer. Among these, hypothyroidism and hyperthyroidism are the most frequently encountered and can affect anyone, especially women over the age of 40. Hypothyroidism occurs when the thyroid fails to produce enough hormones, causing the metabolism to slow down. People with this condition often experience fatigue, unexplained weight gain, dry skin, menstrual irregularities, forgetfulness, sluggishness, and depression. In contrast, hyperthyroidism refers to an overactive thyroid producing excessive hormones, leading to rapid weight loss, a fast heartbeat, restlessness, irritability, excessive sweating, hand tremors, and insomnia. Both conditions can be diagnosed through blood tests measuring TSH and free thyroid hormones, FT4, FT3, alongside imaging techniques such as thyroid ultrasound to assess the gland structure. In some cases, the thyroid may enlarge abnormally, a condition known as goiter, without necessarily affecting hormone levels. Goiter may result from iodine deficiency or autoimmune conditions such as Hashimoto's thyroiditis or Graves' disease. Thyroiditis or inflammation of the thyroid can also cause damage to the gland and is especially common among postpartum women. In rare cases, thyroid nodules may develop into thyroid cancer, which usually grows slowly and has a favorable prognosis when detected early. Treatment for thyroid disorders depends on the type and severity of the condition. Hypothyroidism is typically managed with hormone replacement therapy using levothyroxine. Hyperthyroidism may be treated with anti-thyroid medications, radioactive iodine therapy, or surgical removal of part or all of the thyroid gland. For thyroid cancer, surgery is often the primary treatment, followed by radioactive iodine therapy and lifelong hormone monitoring. Given the thyroid's vital role, early detection and proper management of its disorders are crucial. Maintaining a diet with sufficient iodine, regular thyroid hormone checkups, stress management, and overall endocrine health monitoring are key to keeping the thyroid functioning well. For pregnant women, it is particularly important to assess thyroid health during the first trimester to ensure the baby's normal development. In summary, although small in size, the thyroid is a complex command center with far-reaching effects on the body. Recognizing symptoms early and receiving timely treatment can prevent serious complications and support better long-term health and quality of life. Although small in size, the thyroid gland can develop a variety of disorders that significantly affect health and metabolism. Below are the most common types of thyroid conditions that people should be aware of. First is hypothyroidism, which occurs when the thyroid produces too little hormone. This condition causes the body's processes to slow down, leading to symptoms such as persistent fatigue, unexplained weight gain, dry skin, hair loss, cold intolerance, depression, irregular menstrual cycles, and constipation. Individuals may also experience a slowed heart rate and sluggish reactions. Common causes of hypothyroidism include Hashimoto's thyroiditis and autoimmune disease, iodine deficiency, post-surgical thyroid removal, radiation therapy, or certain medications. The opposite condition is hyperthyroidism, where the thyroid produces too much hormone, causing the body to speed up abnormally. Symptoms include rapid weight loss despite increased appetite, a fast or irregular heartbeat, anxiety, irritability, hand tremors, excessive sweating, heat intolerance, and insomnia. Some people may also have irregular or light menstrual periods. The most common causes include Graves' disease, another autoimmune condition, overactive thyroid nodules, or a temporary thyroiditis. Another frequent condition is goiter, which refers to an enlarged thyroid gland that may be visible or palpable in the neck. A goiter may or may not affect thyroid hormone levels and can occur due to iodine deficiency, autoimmune disorders, or the growth of nodules within the gland. Thyroid nodules are small, solid, or fluid-filled lumps that form within the thyroid. Most are benign, but they must be monitored to rule out cancer. When nodules become large, they may cause symptoms such as difficulty swallowing, a sensation of pressure in the neck, or visible swelling. Diagnosis is typically done through ultrasound, fine needle aspiration biopsy, and blood tests. A special type of thyroid disorder is thyroiditis, which is inflammation of the thyroid gland due to viral infection, bacterial causes, or autoimmune reactions. Hashimoto's thyroiditis is a chronic autoimmune form that leads to hypothyroidism, while postpartum thyroiditis often occurs in women shortly after childbirth. Subacute or viral thyroiditis can cause neck pain and temporary fluctuations in hormone levels, often presenting first as hyperthyroidism, then transitioning into hypothyroidism. Lastly, thyroid cancer is a rare but increasingly diagnosed condition. It is often discovered during routine health checks or neck ultrasounds. There are several types of thyroid cancer, with papillary carcinoma being the most common and most treatable. Symptoms may include a hard lump in the neck, hoarseness, difficulty swallowing, and enlarged lymph nodes. The primary treatment is thyroidectomy, surgical removal of the thyroid, followed by radioactive iodine therapy and lifelong hormone monitoring. In summary, thyroid disorders are diverse and can develop silently over a long period before becoming apparent. Understanding these conditions, recognizing early warning signs, and seeking regular medical evaluation are crucial for protecting overall health. When detected and treated early, most thyroid conditions can be effectively managed, allowing patients to maintain a stable and high quality of life. The thyroid gland, though small and located at the front of the neck, plays a central role in regulating many vital bodily functions. When thyroid disorders occur, they can stem from a wide range of internal and external factors, including immune system dysfunctions, micronutrient imbalances, environmental influences, and hormonal changes throughout different stages of life. One of the most common and concerning causes is autoimmune disease, especially Hashimoto's thyroiditis and Graves' disease. In Hashimoto's, the immune system mistakenly attacks and slowly destroys thyroid tissue, reducing hormone production and leading to hypothyroidism. In contrast, Graves' disease causes the immune system to overstimulate the thyroid, resulting in hyperthyroidism. These chronic thyroid conditions are more common in women and often run in families. Another typical cause of thyroid dysfunction is iodine imbalance, particularly deficiency or excess. Iodine is a vital mineral for the production of thyroid hormones. In areas where iodine deficiency persists, the thyroid enlarges, goiter, in an effort to compensate, which can eventually cause hypothyroidism, especially dangerous in pregnant women and children. However, excessive iodine intake, often through supplements or iodine-rich medications, can also trigger or worsen hyperthyroidism in individuals with pre-existing thyroid issues. Additionally, hormonal fluctuations during life stages can significantly impact thyroid function. For example, women often experience postpartum thyroiditis, a temporary inflammation of the thyroid after childbirth. During menopause, symptoms like fatigue, sleep disturbances, weight gain, and memory loss may be mistaken for thyroid dysfunction. Similarly, puberty and aging can alter the activity of the hypothalamic pituitary thyroid axis, affecting hormone regulation. The role of chronic emotional or physical stress should not be underestimated. Stress can disrupt the central nervous system and endocrine signaling, interfering with thyroid hormone production and regulation. For those with a genetic predisposition, stress may even trigger the onset of autoimmune thyroid disorders. Furthermore, certain medications and medical treatments can impact thyroid health. For instance, amiodarone, a medication for heart arrhythmias, contains high levels of iodine and may cause either hypo or hyperthyroidism. Lithium, commonly used to treat bipolar disorder, can suppress hormone release from the thyroid. Radiation therapy targeting the head or neck area and thyroid surgery may also lead to permanent hypothyroidism. Genetic factors and family history are also closely linked to thyroid health. People with a family history of autoimmune thyroid disease are at significantly higher risk of developing similar conditions. This genetic predisposition plays a major role in how the immune system interacts with the thyroid. Another cause that is often overlooked is infection. Viral infections such as the flu, mumps, or respiratory viruses can cause subacute thyroiditis, a painful inflammation of the thyroid. This condition typically begins with temporary hyperthyroidism and may be followed by a phase of hypothyroidism. Lastly, environmental toxins and chemicals can contribute to thyroid dysfunction. Prolonged exposure to heavy metals, cigarette smoke, pesticides, BPA plastics, and endocrine-disrupting chemicals can impair hormone production or provoke autoimmune responses that damage the thyroid. In conclusion, thyroid disorders can arise from a complex interplay of genetic, hormonal, immune, nutritional, and environmental factors. Understanding these causes is essential for early diagnosis, effective treatment, and, most importantly, proactive prevention. With proper awareness and regular health monitoring, individuals can take meaningful steps to protect their thyroid and maintain long-term well-being.
The treatment of thyroid disorders depends on the specific type of condition, its severity, and the patient's overall health. Whether it's hypothyroidism, hyperthyroidism, thyroiditis, or thyroid cancer, the primary goal of treatment is to restore hormone balance, alleviate symptoms, and prevent long-term complications. For hypothyroidism, where the thyroid gland underperforms and produces insufficient hormones, the main treatment is hormone replacement therapy. Patients are prescribed levothyroxine, a synthetic form of the T4 hormone, to supplement the body's needs. This medication is usually taken daily in the morning on an empty stomach, and the dosage is adjusted periodically based on TSH blood test results. Treatment is typically lifelong, but when well managed, individuals can lead completely normal lives. In contrast, hyperthyroidism, where the thyroid produces excess hormones, requires a different approach depending on the underlying cause. The most common treatments include anti-thyroid medications such as methimazole or propylthiouracil, PTU, which inhibit hormone production. In some cases, patients may undergo radioactive iodine therapy, which selectively destroys overactive thyroid cells. However, this method can lead to permanent hypothyroidism, necessitating lifelong hormone replacement afterward. If the thyroid is significantly enlarged, has multiple nodules, or doesn't respond to medication, surgical removal of part or all of the thyroid gland may be recommended. For patients with thyroiditis, treatment depends on the cause. If the inflammation is due to a viral infection, rest, anti-inflammatory medications, or pain relievers may be sufficient. In autoimmune thyroiditis like Hashimoto's disease, where hypothyroidism eventually develops, hormone replacement therapy is also indicated. In cases of postpartum thyroiditis, symptoms may resolve on their own within months, but close monitoring is essential, and temporary hormone support may be needed in more severe cases. With benign thyroid nodules, patients are typically monitored through regular ultrasounds and hormone tests, unless the nodule grows rapidly, causes difficulty in breathing or swallowing, or shows signs of malignancy. If concerning features are detected, a biopsy or surgical removal of the thyroid gland may be recommended.
Thyroid cancer is more serious, but when diagnosed early, it has an excellent prognosis. The standard treatment involves surgical removal of the thyroid gland, thyroidectomy, followed by radioactive iodine therapy to eliminate any remaining cancer cells. After surgery, patients must take levothyroxine for life to replace the lost hormones and suppress cancer recurrence. Ongoing monitoring with thyroglobulin tests, neck ultrasounds, and occasional full-body scans is essential for long-term management. Beyond medical and surgical treatments, thyroid patients should also pay close attention to diet, lifestyle, and mental well-being. A diet rich in iodine, selenium, and zinc, along with healthy sleep, regular physical activity, and stress management, can significantly support recovery and prevent relapse. In conclusion, treating thyroid disorders requires more than just medication or surgery. It involves regular monitoring, close collaboration with healthcare providers, and a proactive, healthy lifestyle. With proper and timely treatment, most thyroid conditions can be effectively controlled, allowing patients to enjoy a healthy, energetic, and fulfilling life.
Caring for thyroid disorders goes beyond simply taking daily medication. It involves a comprehensive approach that includes lifestyle choices, nutrition, and mental well-being. Whether you are dealing with hypothyroidism, hyperthyroidism, thyroiditis, or thyroid cancer, maintaining a balanced routine and taking a proactive attitude toward long-term health monitoring is essential. First and foremost, taking medication consistently and correctly is a fundamental aspect of treatment. For patients with hypothyroidism using levothyroxine, it's crucial to take the pill in the morning on an empty stomach, at least 30 to 60 minutes before breakfast, to ensure optimal absorption. Dosage should never be adjusted without a doctor's instruction, as even small changes in hormone levels can have noticeable effects on overall well-being. Regular follow-up appointments and blood tests, especially for TSH and free thyroid hormones, are important to monitor the effectiveness of the treatment and make necessary adjustments. Diet also plays a key role in thyroid health. It's important to ensure adequate iodine intake, but without overconsumption, especially in cases of hyperthyroidism. Natural sources of iodine include iodized salt, sea fish, eggs, and seaweed. Additionally, antioxidants such as selenium, zinc, vitamins A and D support thyroid function and boost the immune system. Patients should limit highly processed foods, excessive sugar, trans fats, and caffeine if it causes palpitations, anxiety, or sleep issues. Stress management is another crucial factor in both treatment and recovery. Chronic stress can disrupt the endocrine system and trigger inflammatory or autoimmune responses in the body. Patients are encouraged to practice deep breathing, meditation, gentle yoga, or regular walking to maintain emotional balance and improve circulation. Quality sleep is equally essential. Insomnia or poor sleep can further destabilize hormone levels. Patients should aim for 7 to 8 hours of restful sleep per night, go to bed at a consistent time, and reduce screen exposure before sleeping to improve sleep hygiene. Women who are pregnant or planning to become pregnant should pay particular attention to thyroid screening, especially during the first trimester. A deficiency in thyroid hormones during early pregnancy can affect the baby's brain development. Doctors often recommend testing TSH levels at the start of pregnancy and closely monitoring thyroid function throughout. Finally, it's vital for patients to listen to their bodies and take note of unusual symptoms, such as persistent fatigue, unexplained weight changes, heart palpitations, digestive issues, or menstrual irregularities. Reporting these to a healthcare provider early can help prevent complications and detect relapses or new issues in time. In conclusion, managing a thyroid disorder is a long-term journey that requires patience, awareness, and commitment. By combining proper medical treatment with a healthy lifestyle and a positive mindset, patients can enjoy a full, active life and significantly reduce the risks associated with thyroid imbalances.